more recently, two places I've been where I noticed the toilets was in Ghana and also Morocco. Morocco had many more of the holes in the floor that I had experienced many years earlier in Italy. And again, it was the range of how clean they were kept as to whether or not, and these were, something like a convenience store on the way, on the bus trip, and stopping at the convenience store, and that was the kind of toilet that was available, and it was, some of them were fine, and some of them weren't so fine. So that was just a repeat of my earlier experience, really. But in Ghana, I think was the thing that shocked me most. I like to say that I can't be shocked because I'm from New York City and everything happens there. But I was shocked when I saw that people, I wanted to walk along the beach. I went for some walks, ate some local food at some local restaurants where the average Ghanaian ate lunch, and then wanted to go for a walk on the beach. And there's actually a really nice art gallery on the beach. And I walked up from there and realized that what people were doing is there was a community, a poor community, on the opposite side of the street. And they would walk across the street and go to the ocean and poop. And I mean, I saw people doing this, and I mean, that's just what they did. They didn't worry about outhouses. They didn't worry about what was happening to the water. I mean, this was beachfront property in any other place that would have been valued, really valuable, really prized. And here it was really being sadly spoiled, by the lack of sanitary conditions for toilets. So that was my most shocking experience. And as I think about Ghana, I just really think about that as a potential source of development for the country that is being squandered.
The first time I ever went out of the United States, I went to Turkey, which at that time was considered a developing country. And I was traveling around Turkey with a friend who actually had lived there and spoke fluent Turkish, so we got into all sorts of interesting predicaments and went to places where a Western tourist probably wouldn't go. And at one point we were at the bus station in Bursa, Turkey. Bursa was the first capital of the Ottoman Empire, and I very much needed to use the facilities. And I had already been there for a couple days and realized that there was always attendance at these facilities, that you were expected to pay for the privilege of using these the facilities that they had available. And I went into this lavatory, I guess you can call it, and I walked in, and there was an inch or two of liquid in both the front and the back parts of the facility, of dirty, of unknown origin, really about one of the grossest things I've ever seen in my life. And I rolled up my pants, and because I really had no choice, I was sort of desperate to use the bathroom. And I put my pocketbook on the sink, which was filthy, and it was a cloth bag, and it got permanently stained. It was a souvenir of the trip. And this was the first time, of course, I ever encountered stoop toilets, which are very prevalent around the world. Some people actually prefer it. And there are all kinds of varieties of stoop toilets. Clearly this one had some kind of water systems attached to it, because there was water flowing in the sink, clean water, and I believe it also had possibly some kind of flush system that went into some kind of septic tank of some sort. But nonetheless, it obviously had backed up or something like that. And it was just totally gross. So I went and did my business. I believe I probably washed my hands because it was so disgustingly dirty in there. And when I left the place, I was supposed to have paid the attendant a couple lira, which is maybe 3 or 4 cents, and it was so horrible. I said, I am not going to pay for this. This is, I was being very American. And I just walked away, and the man got so furious at me, he came rushing after me, demanding his money, and in order to avoid an international incident, I went ahead and gave him his 3 cents for the privilege of using this place.
In April 2007, I had occasion to be in Lagos State, Nigeria, for a couple of weeks with my son. The first place we stayed was a tourist hotel, and the sanitation was very similar to what we experienced here in the States. You know, water came up out of the pipe some sort of way. You turned on the faucet and it would come out. The toilets flushed. There were no outside sanitation facilities. Everything was inside, and if not in your room, then down the hall from your room. Then after 2 or 3 days, we went out into the community, and we stayed in a compound with a family. The family was maybe 200, 250 people. It was an extended family. And the compound was the size of a good sized apartment building here in Atlanta. It was enclosed, and the people lived in apartments that opened up into a general courtyard space. The sanitation there was very different. We were privileged guests, so we got to use one indoor toilet. Everybody else used outhouses. Our indoor toilet was very different than the ones that we're used to, though. There was a toilet, there was a commode. There was water in the commode, but the water in the commode did not come from piping. It came from buckets that we would use to put the water in. And we'd put the water in and then use the bathroom and then put some more water in when we were finished. We could wash our hands because there was a faucet, and the faucet was attached to a cistern on top of the roof. And so the water that came out had been heated every day by the sun. And so it was warmer than room temperature. It was a pleasant temperature. So we would run water in the bucket and then dip a little bit out and wash our hands. And then pour that down the drain that was underneath. The water facilities there, you know, for sanitation, clothes washing, cooking, whatever, came from an area that I really don't know where it came from. The children, the young girls would bring the water in every day on these huge tubs that they would carry on their heads, and then they would hold the tubs and dip their heads slightly and pour the water into a barrel or several barrels around. I think they may have filled up the cisterns on top of the roof too, but I don't know. I never saw that. The little children would go to the bathroom wherever they were. They would urinate wherever they were. Not so much on the ground, but there were gullies that ran the length of the apartments all the way around in the compound, and they would, you know, squat there and urinate, and you know, and then get up and leave. As we traveled back and forth to the compound, we would see people out in the street, and these gullies, they were more like open sewers maybe, and people would squat over those and go to the bathroom or just stand up and urinate there. They would throw water in there also after they got finished bathing or brushing their teeth, and they would throw the water into the open sewage area. There were like walkways, not built-in walkways, just boards that people would place across them to walk back and forth, and those ran along the side of the street, you know, everywhere that I was, which wasn't a whole lot of different places, but maybe about 5-10 miles from the hotel. And we would see this. This seemed to be a common everyday sort of practice.
When I was first asked to speak about toilet sanitation or the lack of toilet facilities in underdeveloped countries, the first place that came to mind for me was India. I found that there was just a total lack of toilet facilities in general, which was extremely shocking and eye-opening to me. My first trip to Asia was about 20 years ago, and I was traveling with a friend and her mom, and when I went to get up to go to the restroom, her mother handed me a package of tissues and suggested that there probably wasn't toilet paper in the restroom. It wasn't, common to see it in the facilities there. And when I did finally make my way to the restroom, what I came to find was just two half-cement walls with a hole in the ground. It was totally filthy. And it was from that point forward that I became somewhat jaded and came to expect those types of circumstances when I was in underdeveloped countries, and it wasn't uncommon. It wasn't until I went to India where I really realized that they just had a total lack of toilet facilities and how it was affecting them health-wise in regards to contaminating their food supply and their water supply. When we traveled there, we traveled from Delhi to Agra when we first arrived, and we traveled by train, and we went through miles and miles of farm fields, and we kept seeing men, women, children crouching down in the fields, which appeared to be defecating, or you'd see people urinating. And, we weren't sure if that's what we were seeing until we were at the Taj Mahal, and standing on the terrace, and right behind the Taj there was more farm fields, people living in grass huts in complete poverty. There was no toilet facilities at all, and people were urinating and defecating in the farm fields where there was food crops being grown. So, it was from that point that I really realized that, this was a country that had the great need for toilet facilities and, the need for public awareness in regards to this. It wasn't uncommon. It was a common theme of the trip. Throughout the trip, we saw people in the streets of, big cities urinating, defecating. Often you would see people crouched over the drain system, either using it, to defecate or to urinate. And, you'd even see people on the trains urinating from the windows or the opening doorways of the train, just because there was a total lack of facilities either on the train or at the train stations. I feel this type of public service announcement is important. It's only through sharing these stories and making the public aware about these situations that we'll see changes in these types of countries that are in great need of toilet facilities and awareness about the sanitation there.
The effort to provide clean water has gained traction in developing nations as governments and NGOs work to increase access to education and technology. Even with these efforts, many people throughout the world still use their surrounding environments to dispose of human waste, often using nearby waterways as a method of disposal. This traditional means of waste disposal may have sufficed for most of history, but it is no longer sustainable. Water polluted by human waste may often appear clean, but is unusable for most other activity, as numerous infectious agents find fertile ground for development. The Sanipath study, currently being conducted by Emory University's Center for Global Safe Water at the Rollins School of Public Health, endeavors to understand how human waste travels through urban centers to large bodies of water. Sanipath uses Accra, Ghana as a living laboratory. A new model of quantitative microbial risk assessment, the WHO recommended strategy for comprehensive identification and assessment of all fecal exposure pathways, will be established. Sanipath will develop cost-effective tools for assessing exposure to fecal contamination in urban areas of low-income countries. Sanipath will take place in 3 phases: Phase 1, Phase 1.5, Phase 2. Phase 1, 15 months. Microbiology, molecular biology, anthropology, economics, communications technology, statistics, sociology, environmental science, and other disciplines integrate to identify, characterize, and prioritize fecal exposure pathways. During the initial 15-month period, environmental sampling will be used to quantify contamination, and social science methods used to investigate neighborhood behaviors that lead to exposure. Phase 1.5. Rapid assessment tools will be developed for deployment of cost-effective remedies in a variety of low-income urban areas. Phase 2, 9 to 12 months, will pilot the application of rapid assessment tools in a new field site or conduct an intervention study based on the results of the exposure assessment. The Sanipath study is divided into 11 sub-studies. Each sub-study focuses on a specific pathway of exposure to fecal pathogens. All except households are in the public domain. Septage from tanker trucks. In many cities in the developing world, no operational public sewage or sewage treatment plants exist. Most excreta is disposed by tanker trucks dumping into the ocean. Lavender Hill is a central coastal septage dumping location in Accra. Beaches. Contact with fecal contaminated surface waters, including oceans, rivers, and lakes, is a common fecal exposure pathway in many urban settings. These water points may be used for recreational, occupational, and domestic purposes. Drinking water. Drinking water sources will be identified through transect walks, community mapping, and key informant interviews. Flood-prone neighborhoods. Information gleaned from key informant interviews will be used to determine sampling location in flood-prone areas and study neighborhoods. Urban agriculture. Wastewater irrigation in urban areas is a common practice in rapidly growing cities with poor sewerage and limited water access. Markets. 2 large markets will be selected from 2 study neighborhoods. Water, produce, hands, and ready-to-eat foods will be sampled and analyzed. Schools. Establishing the burden of helminthiasis among children in study communities will provide a crude estimate for the background prevalence of fecal oral pathogens. Open drains. Within each neighborhood, drainage and sewerage systems will be mapped to categorize exposure risks. Human interaction with drains will be observed and environmental samples analyzed. Public latrines. Public latrines will be identified in each neighborhood. They will be categorized, observed, and sampled as part of the qualitative and quantitative research process. Open defecation areas. Open defecation, the unhealthiest sanitation practice of all, is less common than once was, but is still commonplace, particularly in the absence of sanitation alternatives. Households. There are multiple fecal exposure pathways in the private domain. These include household water quality, personal hygiene, food preparation, and storage practices. The prevalence of insects and rodents must be considered. Outcomes. Upon completion, the Sanipath study will provide new mechanisms for rapid assessment of risk exposure pathways found in many cities in the developing world.
A clean outhouse is really not bad, and a nasty outhouse is really, really bad.